slightly another system in ENT, and it's ears, and probably the biggest one you see as well that I see, and that's probably one of the most difficult one, not just in ENT, probably medicine, is around tinnitus. I kind of started saying like, what is like? Everyone knows what tinnitus is. Well, most people know what tinnitus is, but can you explain a bit about how tinnitus happens and why it happens?
So there is a confusion about what is tinnitus, and people think tinnitus is only a loud noise in the ear. Tinnitus can vary from a loud shrieking noise to a humming noise to a whistling noise to a pulsating noise. Any form of a noise which is internally produced in the ears without an external stimulus is tinnitus. And almost every individual would have experienced tinnitus at some stage. It all depends how quiet the surrounding room or the surrounding area where you're sitting is. If it's absolutely quiet, like you and I are wearing a headphone, I'm sure if I keep quiet and if you're quiet, you'll be able to hear a very gentle humming noise in your ears as well. Tinnitus becomes a problem when it is intrusive, which means the person becomes aware of the tinnitus constantly, and they become focused on the tinnitus, and they start to concentrate on the tinnitus rather than what's going around them. And that tinnitus, which is intrusive, then stops them from particularly sleeping at night and concentrating at work. And that's when tinnitus becomes problematic.
Why do these people hear the tinnitus loud? Is it something to do with the frequency that the ear picks up? That is a dysregulation with the the ear shouldn't be picking up essentially is picking up. Is that correct?
So basically, what happens in tinnitus is it's not in everyone, but the commonest form in tinnitus is that patients have got hearing loss. So it's always advisable to have a hearing test done, because in the frequencies where the patient has developed a hearing loss, those frequencies are the one where the tinnitus develop. And I usually explain to my patients that this is phantom noise. So if you ever speak to somebody who's lost an arm or a leg, they'll tell you that I can sometimes I can feel my leg itching, or I want to scratch my arm, but it's not there. That's because the peripheral organ has been taken away, but the central connections are still present. And if there is no peripheral stimulation, from time to time, the central connections fire away. The same happens in tinnitus. When there is hearing loss in a particular frequency, the brain is not getting, the hearing loss is in the cochlea, which is the organ of hearing inside the ear. But the central connections in the brain are still present. And when there is not getting any peripheral stimulation, it starts to produce sort of a phantom noise, which the mind is able to perceive or hear from time to time. And it's usually anxiety, stress, ill health, lack of sleep, which makes, and low mood and depression, which makes tinnitus feel a lot more louder than any other common population.
So what you're saying, there's no peripheral stimulus, so like no loud noise.
Yes.
In people who have got low hearing or a little bit deaf, the brain perceives it's in the frequency. It sends a firing stimulus basically, even when it shouldn't do. Is that what you're saying?
That's correct.
And that comes out as a noise.
That's correct.
So what about in patients who've got no hearing loss? Say if they've got no hearing loss, but they still have tinnitus. Is that?
That's what I was about to say. That's quite common. Second most common cause, but in these individuals, we are not able to identify exactly why patients get tinnitus. There are some theories there which say that tinnitus is produced because of the movement of the outer hair cells in the cochlea. But again, this is not fully proven.
So, because those are the patients, I think, because if it's hearing loss, essentially you can almost mitigate that by giving almost like a hearing aid, right?
Correct.
But with the patients that are difficult are the ones that have got normal hearing, but have these tinnitus that really, it can actually really destroy their life, affects everything, right? They can't work, they can't sleep, it causes depression, it causes anxiety, that makes the tinnitus worse, and it just goes round and round. So they're the patients I think really suffer. But so is there anything that helps or that they can do? Operation or no operation, or supplements or no supplements?
So surgery is not the way forward for tinnitus at all. The only time surgery is indicated if the patient comes to us and says that they can hear a noise in the ear. Usually it's a clicking noise, and and it's not classified as tinnitus. And the only time it is not classified as tinnitus is if you tell the patient that it's a clicking noise and you ask them, can somebody hold their ear close to your ear and hear the noise? And if the patient's attendants say yes, then that is not tinnitus, because there is a stimulus that can be heard. And that is essentially fasciculation of the eardrum, or the muscle inside the ear, which is giving rise to the what we call as myoclonus. So that's not classified as tinnitus, and that's treated with surgery. But it is very rare for that to happen. But otherwise, tinnitus is very common. And the first thing I tell the patients is to help them reestablish their sleep. And what I advise the patients is to either have a little sort of a noise generator, or now there are apps available on the mobile phone where patients can generate a sound which is close to the level of the tinnitus, which is sort of a white noise, which muffles the tinnitus, and that helps them fall asleep. I normally tell my patients, get yourself a small, the water fountain that you can have in a bedroom from one of the big stores. Put it in the bedroom, switch the water fountain on, and the sound of the water itself is calming to the nerves, and the sound of the water fountain actually basically it distracts, or it sort of doesn't allow the patient to focus on the tinnitus. So brain has got some alternative source on which it can focus, and that's how the tinnitus itself can be masked and the patient can sleep well.
I was actually looking at the NICE guidelines recently. There was something about neuromodulation, about that potentially being a benefit, especially in patients like who don't have hearing loss. What are your thoughts on that? Is that a thing you've tried and you've seen work, or is it still fairly new?
So neuromodulation is new compared to other treatment, but the indication for neuromodulation is essentially, first of all, we have to ensure that all the medical causes of tinnitus are excluded. So you want to make sure the patient doesn't have low thyroid function levels. They don't have low hemoglobin levels. They don't have low iron levels. They don't have any cardiovascular problems. There are no neurological problems. There is no clinical history of clinical depression or anxiety or stress. And then you have fully given the patient the trial of what is known as tinnitus retraining therapy. In other words, it's a type of a behavioral therapy. And once all of these aspects have been tried, only then the patient needs to be referred across for neuromodulation treatment. And to be honest with you, in the last 5 years, I haven't sent a single patient. And I see tinnitus patients in every single clinic that I run, and I'm in the clinic 6 times a week. So it's very rare to do that. In neuromodulation, what we do is, again, you put some sensors or probe in some other muscles, usually in the tongue or in the neck, and they stimulate those alternative muscles, and basically stimulation of the alternative spots leads to some degree of neuromodulation or change in the neural pathway, which distracts the individual from there or takes the focus away from the tinnitus.
I see. So yeah, it's true. I think recently there was Chris Martin, the Coldplay singer, had tinnitus. He mentioned about ginkgo biloba. I know he stated it helped him. What are your thoughts on that as a supplement to take?
So ginkgo biloba has been around for 50 years, maybe more. It's a herb which is quite common in the southern hemisphere, America, subcontinent, and it's been used in those countries for a very, very long time. However, the evidence that ginkgo biloba works is very poor. Cochrane did a review on it in 2014 and found it was not beneficial. In 2017, there was a double-blinded trial done which was not beneficial. 2018, they did a trial on 1,000 patients and found it was not beneficial, or in other words, very, very marginally beneficial. So a very small group of patients said that they had some improvement. And the fact that ginkgo biloba, some people say, is helpful, clearly suggests the element of placebo effect of a medication.
Which is obviously very powerful, especially something like tinnitus. If someone feels like, whatever the cause of tinnitus is, if they feel like whatever they're doing is going to help them, especially in tinnitus, you know,
I would say do it. As long as it does not have any side effects and it's helping you with the tinnitus, I would say go for it. Don't stop it.